Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to the DocTalk show. I'm here with Dr. Jaffa and Dr. Billy, our gynecologists, and myself, Dr. Fiona. We are here to answer your questions that you've always had about antenatal care. Most expectant mothers, especially first-time mothers, find it difficult to cope and manage with a new experience and challenges that come with pregnancy. The good thing is that antenatal care is there to detect and manage these problems early enough for the good outcome of the baby and mother.
Yes, it's not surprising that most of the mothers assume that a pregnancy outcome and getting a very nice bouncing baby or a very healthy baby, it's an obvious thing. Yeah,
because usually antenatal, it is a very important aspect, but our mothers who have been there before, I'm having the second, third, fourth baby, they're a bit reluctant to attend antenatal because they've been there before, it's been successful.
I think they're a veteran.
Yeah, so I'm asking myself, I went through it last time, I know exactly what I did, do I have to?
No. What women forget is that each pregnancy is unique. Much as you've had 6, 7 babies, the 8th pregnancy could actually be problematic. People forget that with every pregnancy comes a new experience. So every pregnant woman needs to attend antenatal care.
Those ones carrying maybe the 4th, 5th, and 7th babies, the high risk, we term them high risk. The more you have more babies, the more the risks can come to you, more than these first-time mothers.
Exactly. People come to hospitals, people go to clinics, and do they even know what antenatal is? You'll be seeing someone for the 3rd time and they're asking you, when doctor do I start my antenatal? You know, it's a word that is commonly used. I'm going for antenatal, but most times people...
Yeah. Maybe even as the doctors, you have not explained to these mothers to understand the importance of this antenatal care.
So if I'm pregnant, I've realized that I'm pregnant, I don't know what to do. Who should I call? Where should I go?
Because as the way you see antenatal is the time or the care we give to the pregnant woman from the time she conceives throughout her pregnancy until towards the time of childbirth.
As soon as a woman misses her period or realizes that she's pregnant, she should go for her antenatal care, the first antenatal care visit.
Our mothers, incidentally, of course, there are so many challenges that will come alongside that. Someone will tell you, my periods have been missing ever since I started. I've been skipping. Sometimes I go 2 months without my period. The other time I had a period that didn't look normal, so I can't know whether I'm pregnant.
The reason you're supposed to attend, because if you have had problems with your periods, and these are the mothers who really need to come to antenatal or to come to seek medical care a bit early now.
And pregnancy itself is not about missing periods. There are so many other symptoms that come along besides missing your period.
That will tell you that you're pregnant.
Yeah, exactly. Will give you a high index of suspicion that you could be pregnant.
At this point, that's when people ask themselves, I had a normal pregnancy, I've had 3 normal pregnancies, but why exactly should I go for antenatal care? I think that's a question that most people ask themselves. Or I went for antenatal care last time, but God forbid, I still lost my baby.
And I know I was given ABCD, so can't I just go to the pharmacy and buy stuff?
Yeah, of course, at this point, people need to realize that antenatal is not folic acid. It's not giving, because people think that, doctor, if you...
And not doing a scan.
Yes, come to my office, I do the examination, detect that there's no problem. That is good enough. But people think that if you give folic acid, or if I buy folic acid from the store, that is antenatal.
Not at all, not at all. And the World Health Organization, the Ministry of Health in Uganda has directed that we need to have, each woman should have a minimum of 4 antenatal care visits. Even when the pregnancy is normal and safe, those ones should have a minimum of 4. And we can actually have many more if we have a high-risk mother.
Any pregnancy should be supervised, and it should be supervised for reasons that any pregnancy can develop a complication along the way. So whoever is attending to you, whoever your care provider is, should be able to anticipate these problems or even pick them up if they arise. Sorry. So antenatal care is a very crucial part.
And the good thing is that all our health facilities in Uganda provide antenatal care services. So no woman should go out there and claim that I went somewhere and did not find antenatal care services. They are everywhere in this
Even the small clinics you can run the antenatal. Yes.
And even in the villages.
You don't need any machines to do antenatal care.
So you need, who do I need? A midwife? Do I need a doctor? Do I need a super specialist? Do I need a professor?
Anyone, a doctor who specializes to deal with women or with special treatment, special training to deal with women, or even...
so any doctor can take me through antenatal, yes. A midwife can take me through antenatal, a clinic officer can take me through antenatal.
Yes, a clinic officer will take you through antenatal care. And any health worker who has had experience of dealing with pregnant mothers will take a woman through antenatal care. A midwife who is trained can do the antenatal care and get the mother to the end. Only that sometimes we have those we call high-risk mothers that definitely need to be managed. Yeah,
but because every woman is at risk, we need to remember that 85% of pregnancies will be uneventful, without any problem. But there's a 15% which might get a problem. And perhaps when you do antenatal, you want to look out for these 15% actively, so that we reduce on the mothers who die,
exactly, or
even get complications during
childbirth. The burden in Uganda and most other African countries is still a big one. We lose so many mothers because of pregnancy and their related complications. Approximately 16 mothers die a day in Uganda. That is the current statistics, and that is quite a number. 16 mothers is...
you know, if
that's a taxi
full of passengers.
It would actually make news if
if in Uganda we had a taxi crashing every single day and us losing those people every single day, it would be news all over the place. But when these mothers die, I wonder who talks about them every single day.
Maybe because the ones that we also produce every day are very many. Maybe it counteracts that. Our fertility rate is quite
because high. Uganda is a third. I think has a third.
We have the highest fertility rates almost in the world. So maybe
next to Benin,
because we always have people to get pregnant and
but every life matters. We should not lose a mother.
At this point, we need to know, like the past Figo president who said that women, they're dying not because we don't know what is killing them, but because we are yet to decide whether their lives are worth saving. So it's us to decide that we need to save these mothers.
And that brings us to who makes that decision, because we know that in our cultures we have the husband, we have a mother-in-law, all those make the decision in the woman's life, whether she should even go for antenatal care or not go for antenatal care.
More reason to go for antenatal, because you're looking at most of these things that kill mothers, they are preventable. Look at excessive bleeding, look at high blood pressure during pregnancy.
Difficult labors, obstructed labors.
Exactly.
Abortions and these complications.
You're talking about the early pregnancies. So most of these things can be either prevented or managed appropriately if someone...
And with minimal resources. We don't need this.
But that is why we are involving men. We need high male involvement when it comes to antenatal care. The problem with us is that when a woman gets pregnant, it's a woman's problem. Yet it is a combined effort.
But I think these days, okay, men try, but I think these days also, the women know these days have more money than us. So they're the decision makers.
Whether to go for antenatal
they think that it's not necessary. They don't need to
pass. But looking at the other end of our society, you know that most people are relatively poor. You find they need to go to government settings, and if you've been there, or for most of us who've been there, the queues are so long, unbearable. Someone goes there in the morning, 6 a.m., and they will only see a midwife, a doctor.
Yes, if you're a working mother, basically it means you have to kill a day.
Looking at the other private hospitals, people will tell you they're expensive, I cannot afford, so maybe men are a little bit restricted in that way. So maybe having a plan, and a plan involving you, the mother, your husband, and is very crucial in determining where to go.
Right after this, Dr. Chaffa and Dr. Billy have a lot to tell us about antenatal care, what you'll find when you go to the hospital.
You are watching the DocTalk Show.